Hello and welcome to IMS Today. Today we have a really special guest among us, Dr. Manodeep Sen, Professor of Medicine at Dr. Manohar Lohia Institute of Medical Sciences. You are welcome at IMS Today, sir.
Thank you for having me over here at the Genesis and Biospark event.
Sir, which research do you think is going to completely redefine medicine in next 20 years and why?
Okay. So, of course, there are a lot of research going on. I'll be also highlighting some of the groundbreaking research, especially the Nobel in medicine, which was just recently awarded to three scientists. Of course, their work was in immunology. So I think that I'm a professor in the department of microbiology, which deals with actually infectious diseases. So India, being a tropical country, has to deal with a variety of infections or infectious diseases, which West has rarely encounter. So there, the research on therapeutics, management, infection control, and I see that a lot of students over here have focused on pollution, both air pollution, water pollution management. So these are the ones, how to prevent these infections, different technologies, different innovations, and how our body reacts to it and counters it. So that was the actually event in which our three scientists won the Nobel Prize in 2025, that is on T regulatory cells. So I'll be also highlighting their role, and now it is hardly 30-year-old research, and presently there are over 200 clinical trials over it. So I think these are the core principles of infection prevention. Prevention is better than cure. So definitely, I think we should be focusing on different perspectives of infection control, which can definitely change the course of infections and in turn infectious diseases in medicine.
If you could change something in a way that medicine is taught, what would it be?
So, how it is taught is something, of course. So, the National Medical Commission has recently it has introduced some changes in the curriculum. It is CBME. So, the curriculum has changed in which there is, of course, the didactic lecture is a part of it, but there is also self-directed learning, SGD, so small group discussions, and of course practicals, workshops. So these are the ones how it should be taught. Not always a didactic lecture, that is one speaker speaking and rest are passive listeners. There has to be more interactive teaching so that it gets across, the knowledge gets across and gets applied.
Which new technology do you think will change future of healthcare?
New technology, okay. So there are a lot of technologies which are affecting, like most of the students over here have also used robotics in different applications. So robotics are also being used in healthcare for effective surgical management. So one is these robotics. Next is I think drug delivery. There are different modes of drug delivery. Earlier you would see, I'm talking about a non-infectious disease like diabetics, of which India is the capital. So earlier, if a diabetic had to use insulin, they'll have to, prick once or twice a day for that. So now there are non-invasive ways of the drug delivery, which has made life easier for them. You can inhale it, or even there is enteric coated insulin, which is coming up. And same in infectious diseases also, there are patches for antibiotic delivery also. So, I mean, non-invasive ways of the drug delivery. So I think these are the ones which can definitely affect the compliance of the patient, and significantly affect us.
What is the one quality that every good doctor needs, but that can't be really taught in books?
Okay, so I think sensitivity and as your theme is, basically scientific temper and innovation. So for innovation, one must have a vision, one must have the trust, one must have the data, and finally the capacity to translate that and alignment with it. That is, what's in it for me. So, coming to your theme only, I think these are some of the traits which cannot be actually taught in the books. The vision, one has to seek their own vision, and trust, one has to build that, getting trained, getting the so that others can trust you. Then again, the data also has to be, collected based on that vision, and finally, its application, which translates to a capacity, and finally, our alignment with these goals, which defines what's in it for me.
Thank you so much, sir, for your precious time. I'm Anurag with cameraman Tejas, IMS Today.